Okay, so this week's lab 3 is systemic circulation. Essentially, we're looking at blood vessels, the composition of blood vessels, naming a lot of blood vessels. Right? So we are going to start with types of blood vessels. And it says identify and give a function of each vessel. So we have arteries, which essentially transport blood away from the heart. Right? They're larger diameter vessels than arterioles. And as they become smaller and branch off, we then have arterioles. And arterioles are also transporting oxygenated blood away from the heart, but they are narrower diameter and they are capable of vasoconstriction and vasodilation. So arterioles are capable of vasoconstriction, vasodilation, thus they are a big influencer or contributes greatly to blood pressure. The more we vasoconstrict, the more we put pressure on the blood passing, through the lumen of the blood vessel. The more we dilate, the less pressure we're squeezing down, producing by squeezing down on the blood that's passing through that vessel. Then we have capillaries. Capillaries where we have exchange of material from that which is in the blood and plasma to the interstitial spaces. As far as gas exchange is concerned, we drop off oxygen, carbon dioxide diffuses from those tissues into the blood. Any kind of nutrients we want to deliver, endocrine, hormones as part of the endocrine system, it occurs at a capillary. Why? Because the capillaries are one layer of simple squamous epithelium. And so now we're at a region in this tube system that does not have, 3 layers of tissue kind of keeping material and, let's say, gases and nutrients and blood cells within the cardiovascular system. Now we're in a region that is lined by simple squamous epithelium, and now you have sort of these fenestrations. It's kind of like little open windows in a room where now material inside, can escape and go outside. Those reform to form venules. Venules, are microscopic and merge to form larger veins. Both venules and veins are transporting blood back to the heart. So they're generally indicated in blue, because they're rich in carbon dioxide. Venules and veins have valves that have one-way valves like the heart. And this allows, as muscles to contract and they compress on the veins, the blood has essentially, just like in the ventricles, it should have one way to go. Once you compress the contents of that chamber or that tube, is that the valve behind it closes and the blood has only one direction. And in this case, back toward the right side of the heart. Okay, then in number 2, we are identifying these different veins, arteries. First, we have all the arteries, and then we have the veins that you have to know. So arterial flow to the upper extremities in the head. We're going to look at the aorta, coronary artery, brachiocephalic artery, the right and left subclavian arteries, right and left axillary arteries, so forth and so on. So we're going to look at some of these models, especially on the course page, and I'm going to also kind of go through the notes that I provided up there because it has a good number of pictures, again, of models, and also notes on how to answer these questions that I'm discussing right now. All right, so we're going to identify those arteries. Then we're going to identify the major veins. These, in number 3, are mostly the arteries and veins leading from the heart in the upper chest out to the arms and back and to the legs and back. Down below, when we talk about internal organ circulation, and technically we could combine them all, it probably wouldn't be a bad way to go, is to just follow the pathway. I generally recommend starting at the aortic arch and follow the first 3 branches of the aortic arch out into the arms and back in venous blood, up into the head and back in venous blood. And then I just follow the aorta through the thoracic cavity, through the abdominal pelvic cavity, and what are the branches, what are the organs that, we need to identify the artery and vein to, and I just kind of essentially go down of identifying or inferiorly identifying all the different arteries. I follow that all the way to the abdominal aorta to the common iliac arteries, out into the legs, come back in the veins again, trace the veins back, trace the veins through the abdomen, and then everything right back to, the right side of the heart. So whichever method you want to use is fine. It's just that here in internal organ circulation, I'm telling you exactly which arteries and veins that are in the abdominal pelvic cavity that I want you to be able to identify, and that's the abdominal aorta. You can't miss that. It's the largest diameter red vessel passing through, the chest cavity, the thoracic cavity, and the abdominal cavity. The hepatic artery, which we can find on the liver model. Renal arteries, right and left, because we have kidney models, so that's easy to identify. It's easy to see the spleen as well on models. So I want you to know those arteries and veins as well. There are arteries and veins to the stomach and to the pancreas, but they branch off a little bit more. And, we don't have to identify every single artery and every single vein. If you're looking at a stomach model, then the red, is going to be at least the right or left gastric artery, because there are two different ones. And the blues would be the gastric veins. I think it's, a better example to look at the liver, to look at the kidneys, and look at the spleen, and then just kind of leave it at that. But if you're interested, you can go ahead and look at those as well. So then we will look at also the veins, the inferior vena cava, hepatic vein, the right and left renal veins, the hepatic portal vein, which is one of my favorites, and the splenic vein. Okay. Next, we're going to do the histological identification of arteries and veins, so you can distinguish the difference between them and the layers of them. So we're going to look at a particular slide that has an artery and a vein. Veins are generally larger in the lumen, their diameter, than arteries are. Arteries have thick, what's called tunica medias. The middle contractile layer of smooth muscle, is quite thick. And it generally has a certain amount of muscular tone to it. So what that means is that generally the arteries will stay popped open. They'll look like a tire or a donut. The veins, once you don't have blood in the lumen, has a very thin tunica media muscle wall, and they have a tendency to collapse. And that's one of the major distinctions between the two. So we have three layers, just like in the eye, we had tunics. We have the tunica interna, which would be the deepest of the layers. That's composed of simple squamous epithelium. And just like in the heart, it's to reduce friction. The tunica media is composed of smooth muscle. That's your contractile layer, because all muscle contracts. And then the tunica externa, connective tissue layer to the outside. Just like any other connective tissue, helps kind of protect it from friction from adjacent structures. It helps secure nerves and lymphatic structures to that vessel. And then we enter into the physiology portions, of this lab. So we have factors affecting heart rate. What is the chemical effect on heart rate? Determine the effect of different chemicals on heart rate. And what we're really talking about here is the autonomic nervous system. So number one says, what is the initial effect of increased stimulation on the heart by the vagus nerve? So if we stimulate the vagus nerve, cranial nerve 10, what effect does that have on heart rate? So really what you have to do is be able to say, well, actually, it helps to answer number two first, which will make more sense, is what division of the autonomic nervous system is the vagus nerve part of? Well, it is part of the parasympathetic division. Remember, the cranial nerves associated with the parasympathetic division, because that's a craniosacral outflow, origin of the nerves are from the cranium, are 3, 7, 9, and 10. Cranial nerves 3, 7, 9, and 10 are part of the parasympathetic division. So vagus nerve. So now you go back, you go, okay, well, what effect does the vagus nerve have on heart rate? What do we want to do when we're in parasympathetic rest and digest mode? We want to slow down the heart, so it decreases heart rate. And that takes us to number 3. So what is the effect of increased epinephrine, or really norepinephrine, on heart rate? So what division of the autonomic nervous system has a similar effect as epinephrine on heart rate? All right, well, sympathetic nervous system is designed to increase heart rate. So epinephrine is going to increase heart rate. What division? Sympathetic nervous system. And based on the relationship between blood flow and heart rate, what is the effect of increased heart rate on cardiac output? So that would be to increase, because we said cardiac output is a function of stroke volume times the number of beats per minute that your heart is beating. And so if we increase heart rate, we're pushing and pumping more blood through the heart. So it increases cardiac output. And then we go to number 7. We have number 7 and number 8. Cardiovascular dynamics. So now we're kind of, we talked about blood flow and resistance to blood flow in the blood lab, right? We said that factors that increase resistance will decrease blood flow. Right? Things that increase the viscosity is increasing resistance and decreasing blood flow. So now we're kind of talking about, we said also, we addressed the length of the vessel, the diameter of the vessel. Well, it comes back again, in now that we're looking at arteries and veins. So part A, the effect of blood vessel radius on blood flow rate. Right? So it says, describe the effect of vasoconstriction, a decreased radius on blood flow. So if we squeeze down on the blood, it creates more friction and resistance. So we will decrease blood flow. Part B, the effect of blood vessel length on blood flow rate. Well, again, we talked about this in the first lab. We said the longer the vessel, the more opportunity as blood is passing through the interior of this hose, so to speak, is that the friction of it passing across that, tunica intima, the inner layer of tissue, becomes greater and it slows it down. So again, the longer the vessel length, right, the slower the blood flow rate, or the longer it is, it will continue, I guess, to slow down. That's the best way to describe it. Blood flow will decrease. Then we have the effect of blood vessel pressure on blood flow rate. So describe the effects of increased blood pressure, on blood flow. So if we increase the pressure, which means that we're compressing down on it, and it kind of depends, really on why we're increasing blood pressure, but I would say that generally it will decrease. Especially if we're talking about blood pressure due to vasoconstriction, the blood flow is going to decrease. Okay, then we get into cardiovascular dynamics. So it says here we have knowing that blood pressure equals cardiac output times R for resistance or peripheral resistance. What would be the effect of each of the following conditions on blood pressure? Increase, decrease, or no effect? And now also to keep in mind, what is the equation for cardiac output? Right? Because you could rewrite that and have BP equals stroke volume times heart rate times R for resistance. Right? Okay. So let's take number 1, decrease cardiac output. So just algebraically, let's just keep this in mind, is that we have the equal sign in the middle. If we change CO or R, and we're not going to change both of them at the same time because that would not be a fair question for you. But if I increase CO, decrease CO, What effect does that have on the term on the other side of the equal sign? Well, if CO goes up, BP goes up. If CO goes down, BP goes down. And then looking at resistance, again, R goes up, CO stays the same, that's implied. Increase R, increase BP. Decrease R, decrease PP. Right? But I would keep in mind maybe right above CO, right in there, stroke volume times heart rate, because now we have essentially three terms. And if any one of those increases, blood pressure increases. Any one of those decreases, blood pressure decreases. Okay, so this is talking about blood pressure. So decrease cardiac output. If I decrease CO, I decrease blood pressure. Number two, all right, so this is directly related to what I just said, increased heart rate. And you go, uh-oh, what does heart rate have to do? I don't see HR on BP, CO, or R, because heart rate is one of the variables, is part of cardiac output. Cardiac output equals stroke volume times heart rate. So if heart rate goes up, blood pressure goes up. Increased systemic vasoconstriction. So if we vasoconstrict, we increase resistance, we increase blood pressure. Increased systemic vasodilation. Right now we've decreased the resistance, so we decrease blood pressure. Number five, increased blood viscosity. All right, so that makes it thicker. All right, when it's thicker, it creates more resistance to blood flow. So if R increases, blood pressure increases. So it's increase. Decrease blood volume. So that's a good one. All right. If we decrease the volume of blood circulating, overall volume, it didn't say just you're dehydrated, it just means overall volume of blood. It means we've decreased the resistance. If we decrease the resistance, we decrease blood pressure. Okay, then we get to 7, increased parasympathetic stimulation. So you go, okay, what does it mean to increase parasympathetic stimulation? So we're going, okay, well, we're really talking about its effect on heart rate. So if we increase parasympathetic stimulation to the heart, we're slowing it down. All right, so if you decrease heart rate, which is part of cardiac output, we decrease blood pressure. And then we have increased sympathetic stimulation. Well, that means we're stimulating the heart rate to go faster or to increase. Increase heart rate, increase cardiac output, increase blood pressure. And then number 9, increase blood vessel length. That increases the resistance, therefore increases blood pressure. So the types of questions you probably asked, or you generally are asked, are generally word questions, based on this information. Hey, if the blood vessel decreases, blood vessel lengths decrease, what effect does that have on blood flow? What effect might that have on blood pressure? Occasionally you might point to a heart model and, and point to maybe the essay note, where you have both sympathetic and parasympathetic fibers, nerve fibers terminating there to decrease and increase heart rate when needed. And so you might be able to say, hey, what is the effect of increased sympathetic or parasympathetic, on heart rate? Or what would be the effect of, epinephrine binding here? Or, you should know acetylcholine using the parasympathetic division maybe. But most questions you're going to come across are just going to ask you increase, decrease, parasympathetic stimulation. What effect does it have on heart rate? Maybe cardiac output. That's a fair question. And even blood pressure. And increasing and decreasing parasympathetic stimulation. What effect would it have on heart rate? What effect would it have on cardiac output? And what effect would it have on blood pressure? Okay, so I'm going to stop that share and I'm going to get into the images. So let me change my page here. Okay. So most of this is just what I call point and shoot, but I'm going to cover some of these with you. And then I want to actually go back and into the notes and cover the highlights there as well. So here we have, I call them the cookie sheet models. They're these plastic, large models, that are flat. They kind of look like a great big cookie sheet. So here this is another example of a heart model, which we didn't have pictures of last week, but this is also a fair model to use to identify the anatomy of the heart that you looked at on some of the models, like what I call heart on stick models. There's also this model as well. But over here on the left is where we want to kind of highlight some of the structures that you should be familiar with. And the red vessels, of course, are arteries, and blue are veins, with the exception, of course, at this point, pulmonary circulation, as you know. All right. But over to the lower left-hand side, we have C and D. C is blue, so it represents a vein. And the one in red, D, represents an artery. The artery, and there's another model for this as well, shows you 3 layers of tissue, the outer, the middle, and the inner. I think it's like 38, 37, and 36. The outer layer, 38, would be the tunica externa, connective tissue, kind of protects the vessel, from friction, secures nerves to it, lymphatic structures to it. 37 is the middle layer, the tunica media, composed of smooth muscle, that's your contractile layer. And 36 is your most inner layer, which is the tunica intima or interna, simple squamous epithelium to reduce friction. Over on the left, we have a vein, and it has 3 layers as well. But, we're going to, I think in a subsequent model, it shows you the 3 layers of the vein individually. But it doesn't, generally, we're going to use one of these arteries. But what's unique in the vein that the artery does not have is that valve in the center there. And the valves prevent blood backflow. Just like valves in the heart and valves anywhere else. They're designed to allow blood or fluid to pass through in one direction, and when it falls back down, it essentially closes the door behind it. Here on this model of the heart, it actually gives you, again, good representation that the direction of blood flow using the arrows, starting over on the right-hand side, the superior vena cava, inferior vena cava, into the right atrium, which is big number 4 there, right in the center, through a tricuspid valve to the right ventricle through the pulmonary valves or semilunar valves to the pulmonary trunk. And then at 13, it bifurcates into right and left pulmonary arteries. Remember, it's still blue, because we still are carbon dioxide rich. Goes out to the lungs, you gas exchange and come back via 14 on the right and 14 on the left. Those are the pulmonary veins, but they're red because they're fully oxygenated. They transport blood to the left atrium, through the mitral bicuspid valve to the left ventricle, from the left ventricle through the aortic valve to the aorta. Doesn't give you a good example of the right and left coronary arteries, but down on the bottom, it does give you some, pretty good picture of the chordae tendineae and the papillary muscles, which is number 6, and the chordae tendineae attaching to the valves there. And then as we travel superiorly through the aorta to the arch of the aorta, we have our first 3 branches off the arch of the aorta. The first one is the brachiocephalic artery, which is number 16. 17 is the left common carotid artery, and 18 is the left subclavian artery. So this is a good model for the heart as well as blood vessels. Okay, this was sort of the one I was thinking of. So it's not like that cookie sheet model, but this is about, I don't know, 10, 12 inches by 10 inches, something like that. All right, so we have the number 1, which represents an artery. You can see 3 layers to it, the outer in red with the yellow little nerves on the surface, the middle layer in brown, and then the most internal layer in white. Tunica externa, tunica media, tunica interna. That's an artery. Functionally transports blood away from the heart. Then that will break down into smaller red vessels called arterioles, and that's what 2 is trying to point to. All right. So two are arterioles. Right? They are capable of vasoconstriction and dilation. Therefore, they are integral in affecting blood pressure. And they are also transporting blood away from the heart. That travels further and continues further and becomes smaller and smaller vessels until finally you have this network of fine, narrow diameter red vessels that end up merging with the blue vessels, and now then ultimately form venules to veins to transport blood back to the right side of the heart. So this finer network, number 3 is pointing to, it includes the red and the blue fine network of vessels there. Those are the capillaries. You come in oxygen rich. The capillary has one layer of simple squamous epithelium. So now due to that hydrostatic pressure of the heart pumping and pushing blood through this arterial system, when the blood finally gets to this region of a capillary, which really allows about one red blood cell at a time to pass through there, we have kind of gaps or little open windows between the walls of those squamous cells. And now, fluid in any molecular size that is capable of squeezing through the window is going to leave the blood inside that capillary and go into the interstitial spaces. And that's how we drop off oxygen and different nutrients, hormones, and so forth. The blood pressure starts to drop, and as it travels to the other side, the pressure within it still diminishes, and the blood volume is diminished because we've lost a lot of fluid, when we're pushing and pumping out water through those capillary walls. But as the blood passes to the venous side, and we've lost a lot of that fluid, the contents of the blood, the albumin, the red blood cells, white blood cells, platelets, all our formed elements have an osmotic power or draw to pull water from the interstitial spaces back into that capillary. So it helps to restore blood volume. And so you kind of push water out initially on the red side, and you kind of suck a lot of it back in on the blue side, because we have, we developed what's called osmotic pressure inside that blood vessel. Kind of acts like a hypertonic solution. So it draws water to it. Not all of it, because that's what the lymphatic system is going to be for, but it draws back a good amount of it. And now the blood reforms from the blue capillaries to, oops, there goes my phone. Hold on just a moment. To form a venule, which is a narrow diameter vein, kind of like an arterial. And then multiple venules merge to form a vein. Veins merge to form larger veins. And then they transport blood by the superior vena cava, the inferior vena cava, and the coronary sinus back to the right atrium. All right, so points to an artery, arterial, and capillary. Arterial, even though there isn't a function listed here, it is in your lab worksheet. So yes, I want you to know, the function of an arterial. Vasoconstriction and dilation, thus it impacts blood pressure. I think there should be, okay, then in this picture, where the 1 is pointing to the venule and the 2 is pointing to the vein. And on both of those, you can see 3 different layers. In the middle, in the lumen of that vein, that 2 is pointed to, you can see the valve. Okay. And by the way, there's more than one valve, but you can just see it in that particular region. Okay. All right, so let's start identifying some vessels. Usually I go out identifying the heart, but you can use whichever the pattern of the arterial blood, from the heart out to the arms and back by venous blood, up into the head in the coronary carotid arteries, and back in the jugular veins. But these pictures just kind of go in random order. So here we're looking at 2 vessels that merge to form 16, which is the superior vena cava. And then below that, you can see just the top of, the right atrium. All right. Those are the 2 brachiocephalic veins. 17 is the right brachiocephalic vein. 18 is the left brachiocephalic vein. How do you know that? Well, if I took that heart model, I put it right in my chest, 17 would be on my right side, 18 would be on my left side. But also here, look at the location of the aorta. It's pointing to the aorta, and the aorta courses to the left, and travels in the left side of the thoracic cavity. All right, now we're looking at the heart and some vessels in, what's called one of the thoracic cavities, where you can see lungs and you can see blood vessels. Now the heart's been removed, all right, but here we're pointing to one, which is the aorta. Once it continues from the arch of the aorta and it heads inferiorly, or courses inferiorly through the thoracic cavity to the diaphragm, it's named for the cavity it resides in. So it's a thoracic aorta. Many blood vessels, or most of the blood vessels, even though they're really stemming from and they're a continuation of the same vessel, as it passes through different regions of anatomy, it assumes a different name. So you kind of have to know, where does it go from being called a subclavian artery to an axillary artery? So I'll give you some hints on, the places that you most want to look for, where generally someone might put an arrow, to say, hey, identify this artery or identify this vein. So we have the abdominal, the thoracic aorta. We have, again, your brachiocephalics. You have a right brachiocephalic vein here. 3 is pointing to a left jugular vein, and 4 is pointing to a left subclavian vein. So thoracic aorta, brachiocephalic vein. You should know that that is a right brachiocephalic vein, a left jugular vein, and a left subclavian vein. You should be able to identify right and left. That's kind of helpful when you're working in a hospital. Here we're pointing to, in this model now, that person, well, it's not a person, it's a model, has turned its head to the right. So you're looking at the left side of the neck. Ding, ding, ding. All right, so we have the left common carotid artery and the left jugular vein. Okay. And again, this is coursing over to the left side. 1 is pointing to an artery, 2 is pointing to an artery, 3 is pointing to an artery. So 1 is pointing to the subclavian artery, 2 is pointing to the axillary artery, and 3 is pointing to the brachial artery. This is a kind of a hint. You see the glenohumeral joint here, not the fold in the skin of the armpit, but where the proximal end of the humerus is articulating the glenoid fossa, right? That joint, usually right up, where that branches of that artery there to the one below it. They will point in that general region, about level with the glenohumeral joint, to indicate the axillary artery. And then the big red vessel that parallels the shaft of the humerus would be the axillary artery. And those are lefts, of course. Over on the other side of this model, we're looking at some of the arteries and veins, in the forearm. All right, so this is the right-hand side. Okay. All right, because you can see the big liver there, and the heart's over on the left-hand side. Inferior vena cava is always on the right-hand side, and the aorta is on the left-hand side. So where the bone on the thumb side of the forearm is the radius, and the bone on the pinky side, PU ulna, is the ulna bone. So those are red and blue, the right radial artery and veins, and the right ulnar artery and veins. So it's specifically pointing to the red now, but you can see them paralleling each other. Radial artery, ulnar artery, right side. All right, and now we're looking into the abdomen. We have the big number 2 is the abdominal aorta, and 1 is the inferior vena cava. Okay, this would be nice if it was rotated around, but we're going to follow the inferior vena cava down into the abdomen, where it bifurcates into 2 big vessels, you have a common iliac artery to the right and a common iliac artery to the left. And whenever you have common in the title, it means that it's going to split off either into, a superficial or deep, internal or external, something along those lines. So that if you can see the branching off that right common carotid artery, it travels in toward where your bladder would be located essentially, and that is your internal iliac artery. But it continues as this large vessel passing by the femoral acetabular joint as the external iliac artery. But we can just call it the iliac artery, that's fine. And that is the right side. It continues and it passes under a ligament here and parallels the femur as the femoral artery. It courses anteriorly initially and then passes through, what's called the adductor connective tissue layer and travels and switches its position from the front of the thigh to the back of the thigh and the back of the knee. So 3, that left leg is has rotated its knee out so you can see behind the knee. And when that femoral artery passes through the bend of the knee, that's the popliteal area. So it's called the popliteal artery. After that point, after it courses more inferiorly, it's going to branch off, and you can see some of the branches just to the left-hand side of the knee joint. It's going to branch off into an anterior and posterior tibial artery. You're either on the anterior aspect of the tibia or behind the tibia. All right, so that's what we're looking at here. One, when we're at the right leg that we're looking at, which is the vessel 1 is pointing to, that's the right side. The tibia is behind it, so this vessel is anterior to the tibia, that is anterior tibial artery. Again, that left leg has the leg rotated, externally, so we could, just before we were looking behind the knee, now that vessel continues as the posterior tibial artery. Now, technically, just to the right-hand side of 2, you see that 82, that is also an anterior tibial artery. We've just kind of turned the leg around. And it continues once it passes that ankle joint where the number 3 actually is, then it continues on the dorsum of the foot, the top of the foot, as the dorsalis pedis artery. That is a pulse point to establish proper circulation or adequate circulation of the foot, not only there, but just behind as you follow the posterior tibial artery as it wraps, it's around the medial malleolus, which is really just under that, that yellow 3 arrow. If you could just lift that up and follow that posterior tibial artery, that's another pulse point. Just FYI, if you want to try to find them on yourself. And it's a dorsalis pedis artery, not just dorsalis pedis, it's dorsalis pedis artery. Okay, now we're going to look at, not only the inferior vena cava, which is the blue, and the aorta in red. Inferior vena cava is 3, aorta is 4. Knowing that the aorta is on the left-hand side and the inferior vena cava travels on the right-hand side because deoxygenated blood returns to the right side of the heart. Let's look at the kidneys. Each kidney has an artery and vein supplying it. And knowing that the aorta is on the left side and the inferior vena cava is on the right side, as well as the right kidney sits a little bit lower than the left kidney does in this abdominal region. It's technically retroperitoneal. Is that those are renal arteries and veins, and therefore number 1 would be the right renal artery, 2 would be the right renal vein, and if we were pointing on the other side, you'd have the left renal artery and the left renal vein. Here we have a liver. It's point on the undersurface. We have 3 vessels that travel together. We have the blue vessels that are formed from the veins merging, that are draining deoxygenated blood from the digestive organs into one big vein called the hepatic portal vein. So the veins from what are called the mesenteric veins from the small intestine, large intestine, the veins from the spleen, the stomach, the pancreas, instead of traveling to the inferior vena cava and the deoxygenated blood traveling toward the right atrium, they are going to merge to form what's called the hepatic portal vein. So they merge so that all the nutrients and all the substances that they absorbed from those organs can travel to the liver first. So we have the hepatic portal vein. In green, we are going to have a bile duct, and the red, which is number 1, would be a hepatic artery. So we have 2 vessels transporting blood to the liver on the inferior surface, the hepatic artery and the hepatic portal vein. The duct is transporting bile away from the liver and storing it in the gallbladder. You can see the gallbladder inferior to the number 2. 3 is pointed to the hepatic vein. So once all this blood from the hepatic artery and the hepatic portal vein circulates through the liver, then it will all recollect, via the different, kind of the central canals, of each lobule, central veins. And all those central veins will merge to form a hepatic portal vein, a hepatic vein, and then that transports the deoxygenated blood to the inferior vena cava. And that's what the big blue vessel in the center is the inferior vena cava. It's just been cut to the superior and inferior aspect. All right. And then, so here we have 1, 2, 3, and 4 pointing to veins. We have a right subclavian vein, right axial vein, right brachial vein, and a new one called the median cuboid vein. We have some extra veins than we do arteries, because the venous side of blood, is what's called a volume reservoir. There are more veins with larger diameters. When blood is circulating at any point in time, it's not 50% on the arterial side and 50% on the venous side. It's about 35%, 40% on the arterial side, and the remainder, which is about 70 to 65%, is in the venous side of circulation. So that median cuboidal vein runs obliquely across the anterior aspect of your elbow. It's a common place to get a blood draw. And then 1 or 2 are pointing to those radial and ulnar veins. Down here in the lower extremities, there are a few veins to identify. We have an anterior and posterior tibial veins, but we again have an extra vein. We have the great saphenous vein. We have a lesser saphenous vein and a great saphenous vein. And the great saphenous vein forms on what's called the dorsum of the foot. If you look down on the foot, you can see this network there. And it runs very superficially, very close to the skin in the inside of your thigh. It travels all the way from your ankle, all the way to the inside of the thigh. That's what number 2 is pointing to. It eventually merges with the femoral vein at about the level, here of what's called the inguinal ligament at the femoral acetabular joint. And then it continues as number 1, which would be the iliac vein. So we have 1 is the iliac vein, 2 is the great saphenous vein, right-hand side, of course, and 3 is a tibial vein. You have anterior and posterior, but the models sometimes can't show you every single thing. So these are examples of ones. Looking in the abdominal pelvic cavity, we have a few arteries and veins to identify here. Right? So we have 1, 2, and 3. We have going to the liver. We have vessels here traveling to the liver where number 1 is pointing to. We have a pancreas and a spleen over here on the on the left-hand side, and we have kidneys. So we have the hepatic artery and vein at where number 1 is. I wouldn't use that picture to ask because you can't quite, you want it to be a little bit bigger, and you really want to be able to have, be able to really see what the tip of the arrow is pointing to, something red, something blue, which are totally different, and maybe something green, which would be like a bile duct. But it represents the area of the hepatic artery and vein because they're lumped together there. Splenic artery and vein, renal artery and vein. Again, I don't use, just look at that again. No, perhaps to the spleen, perhaps number 2. That's a good one. If I were going to ask you renal artery and vein, I would use that other model that we looked at where you just have, the kidneys and inferior vena cava and an aorta. Okay, this is a histological slide of an artery versus a vein. Artery is there at the pointer. You can see the thick tunica media. The inner layer that's adjacent to the lumen is the tunica interna. Tunica media is the thick pinkish purpley wall, and then the squiggly dark staining region to the outside is the tunica externa. That's an artery, and below it to the left a little bit that's collapsed on itself is a vein. So we have an artery, carries blood away from the heart. It's pointing to the tunica media. That is your smooth muscle layer, and it functions to vasoconstrictor dilate. It's your contractile layer. Upon vasoconstriction, you increase blood pressure, and in contrast, vasodilation decreases blood pressure. Now we're pointing to a vein. Veins carry blood to the heart. They contain valves. Okay, so that's the end of those images. I'm going to just quickly do one more thing, and that is to just show you under the content here, the systemic circulation lab notes. Let me change my share here. But these notes are there for you to use to answer questions as well. That material is always in here in case you do have a different lecture teacher. And here it talks about the general order of vessels, arteries, arterioles to capillaries, what their functions are. Venules, veins act as blood reservoirs. They contain one-way valves. Blood vessel histology. They have 3 layers: tunica externa, media, interna, connective tissue, smooth muscles, simple squamous. The blood vessel slide, an artery or an arterial, has a very large tunica media, functions to vasoconstrict and dilate, has the donut tire appearance, a vein in blue because it carries deoxygenated blood, has a thicker tunica externa, thin tunica media, and it's often collapsed on itself. Here's another. This actually identifies A, B, C, and D, the different layers of the tunics. These are very good images to study from, not just the ones on the course page. I use these as well. Here is a blow up of that other first cookie sheet model that we looked at, and I said that there was a better picture along the way. So this shows you that internal, medial, and external layers of an artery in red and vein to the right. We don't generally point to those 3 different layers, but you could, you could. And the valve in red, D in the center, unique to veins. So these notes describe verbally the pathway of blood, leaving the arch of the aorta up into the arms and back, up into the head and back, the arteries, and then venous drainage back to the right side of the heart. So you can look at those on your own. And as I said in here, when it came to veins, often veins will be named the same as the artery. However, there are always exceptions. We have carotid arteries in the neck, but jugular veins. let's see. So then this gives you the pathway of blood. You can look at those if you like. It talks about the hepatic portal vein. Some more diagrams or pictures of those same models, but a little magnified so you can distinguish a little bit better. I would study from these. I like these. These were from a different image database. This is similar to what we looked at before. It's just, you know, a little bit bigger so you can distinguish a little bit easier the reds from the blues. This is on the right side and so forth. All right, so take a look at those. At the end, here we're talking about the liver and the hepatic portal vein, hepatic artery, and the hepatic duct, or the bile duct, whichever term you prefer to use at this point. We will distinguish between those when we get to digestion. More models, and this discusses the PhysioX we were just talking about. You know, I think it was exercise 7 and 8. Cardiac output is heart rate times stroke volume. Blood pressure is cardiac output times resistance. Maybe rewrite HR and SV into cardiac output. And it discusses the effects of those different variables. I need to change that. That epinephrine, norepinephrine is misspelled. And that answers those sections. So that's it for this Zoom share. If you have any questions, send me an email.